So I've been away from making videos for the past couple of weeks or maybe a month because I've been spending the midnight oil trying to create an NCLEX study material. I mean, interesting as that may sound, it is like one of the most asked questions on this channel about what do I recommend that people use to study for the NCLEX and so on and so forth. So I decided to make one of those materials because I mean, like, anything is not within the scope of anyone as long as you put your mind to it. But why am I making this video? It's because in trying to investigate the materials already out there that some of us used and that people are continuing to use in order to help me build a good foundation for my material, I came across some gaping loopholes that I never witnessed or that I never got to know during the time of my preparation for the NCLEX using the same material that I'm having to investigate now. And one of them is this REMA Quick Facts Guide. It's one of the household names for NCLEX study materials. But the problem with these materials has been occasioned by the lack of a standardized material for NCLEX preparations. So there's nothing like this is the textbook that you go to approved by the testing body for you to use. So everybody has to come up with something. And so schools have multiple study materials. There is REMA, there is Archer, there is UWorld, there is Kaplan. The truth is that there's a difference between a material that makes you good in content and a material that makes you a good test taker. So for example, if you look at the Bruin and Sadat material, which is that voluminous compendium of material, you can read everything in it and be a good person or be a person who is very deep-seated in content knowledge, but the framing of the NCLEX questions will be different from what you know, and so you'll probably be a bad test taker even though you are deep in content. And it's the same with Kaplan materials. And so this challenge, which is very obvious, has led to the advent of other materials like this one, which is a quick fact guide. I mean, there are several other quick fact guides, but I just wanted to use this one to make this point. The name suggests that it's a quick fact guide, which means that the author is admitting that the material here is not exhaustive by any imagination. And so what it means is that for you to be able to make sense of what's in the quick fact guide and not be lost when the questions are twisted in a format that is different from what is presented in the quick fact guide, you need to be very deep in content. So you must use a material like Bruin and Sadat or Kaplan's materials or any of those voluminous materials, and then be deep in content, and then you can make this material make sense. If you are trying to make yourself prepared for the NCLEX and you are trying to use quick facts guide, it's quick, it gives you some facts, but there are also tons of omissions. For example, I'm not trying to be needlessly hard on REMA, it's just because that's one of the very common ones and that's what I got my hands on for this video. For example, this material is talking about side effects of Parkinson's medications, and it says that there's altered vision, blurry vision, altered vital signs, constipation, confusion, dry mouth, dizziness, and it says teach clients to self-monitor for improvement of Parkinson's symptoms and tell clients do not stop this medication immediately. I mean, all of these are very important things that you need to tell a client. But one of the key things I have noticed in working with patients who are Parkinson's patients and also taking Parkinson's medication is that a lot of them have underlying psychiatric conditions, and so they are going to be on antipsychotic medications. And so if you are taking a Parkinson's medication like, let's say, carbidopa or levodopa, and you are taking an antipsychotic medication, let's say a benzodiazepine, any of the common ones, what's going to happen is that you are going to have an interaction. And once there's this Parkinson's medication and psychiatric medications interactions, what you're going to witness in the patient is a bizarre exacerbation of their psychotic symptoms. So you witness ordinarily or otherwise normal Parkinson's patients with their rigidity, tremors, and akinesia becoming aggressive as well. Like, they become aggressive and combative, and sometimes you have to call a code gray on them. And the reason is not because of the underlying etiology of Parkinson's, but because of the interaction between the Parkinson's medications and the antipsychotic medications. I mean, I've had to experience this so much that even the neurophysics unit sometimes has to call me to notify the doctors not to prescribe these medications. So you might think that this is very detailed, but these are things that actually happen, and the NCLEX does ask questions like this. So for example, if you read a Bruin and Sadat, maybe you see that material, this thing I said, in there, but in the REMA Quick Fact Guide, there's no way this is going to come there. But this is a question that I've seen in the NCLEX before, like drag interactions. So you definitely have to focus on building your content with some of the other materials that I spoke about, like the deep materials. And then as a way to prepare for the exams, you are supposed to use this quick facts guide, including any of the other quick facts guide. I mean, the one I'm creating included. What I'm saying essentially is that this is not a go-to all, or this is not an answer all material that is going to make you fully prepared. I mean, some of the authors have even started to add secondary materials, like they tell you they have you need to combine this material with another material so that you become very completely prepared, because they admit what I'm talking about, that this material, this study materials, all of them is by no way an exhaustive study material. And so if you are preparing for the NCLEX, you might have a question bank, but make sure that you are working with the question bank as well as working with the other materials that make you deeply rooted in your content, and should make the NCLEX very, very simple and straightforward to pass. It's sad when I speak to people who have passed the NCLEX or have had to fail the NCLEX multiple times before passing, tell you that the challenges they had were variations in like the formats of the questions. Like, for example, there's another one that's talking about bronchodilators, and it's saying that when you are giving bronchodilators in this material, it's saying that teach the patients that it may cause increased heart rates and all of that, and patients should avoid caffeine in diet, blah blah blah, and so on and so forth. And these things are true, but one of the things that is key when you're taking bronchodilators and some of these inhalations is that the patient has to rinse their mouth, because the residue or the remnants of whatever they inhale can cause oral thrush if they don't rinse their mouth. And so this is like something we tell the patients all the time on the ward: rinse your mouth after you inhale, so that you clear your mouth and reduce the chances of you having thrush in your mouth. But this material does not have that. Now, this is a very essential study point or study tip for whoever is preparing for the NCLEX exams. And I mean, there are so many of them, but I'm just going to be fair to the author and not go so much into the lapses in this material. But all I'm saying is that make yourself deep in your content, or deep in your core content, your core knowledge, before you add these materials, okay, which are very useful in making you ready for the NCLEX exams. I'll just go back to working on my material, and of course, hopefully I'll be able to make more videos within the time that I'm working on these materials. But thanks for sticking with me and watching the videos, and for all of you who have been sending emails, I'm definitely trying to answer all of them while I juggle a few other things like I said in this video. Thank you, and I'll catch you in the next video.